Hi, everyone, and welcome to hashtag See Arthritis. This is Arthritis Consumer Experts annual event. This is our 12th year putting on this program, and we couldn't be happier to have Dr. Timothy Kwok in studio with us to talk about the research that he will present on his poster. So, welcome to the studio, Dr. Kwok.
And thank you for having me.
Yeah, I'm going to introduce you to the audience really quickly, and then we're going to dive right in. Dr. Kwok is a rheumatologist and clinical investigator based at Sunnybrook Health Sciences Centre and the University of Toronto. His research program is focused on really three main areas, and that's one, gathering evidence using real world, meaning you collected it from me, right? And EMR, or me, people like me rather, and electronic medical records data to improve the quality of care delivered to patients with gout. Two, utilizing population level data to improve access to care for patients with rheumatic diseases, so all types of arthritis. And three, evaluating prognosis, comorbidities, and optimizing treatments for patients with inflammatory arthritis. So three main areas of research interest. And the one we're going to talk about today, Dr. Kwok, is your poster on healthcare utilization patterns among patients presenting to emergency departments for gout flares specific to the province of Ontario. This is a population-based retrospective observational study, and I deserve an award for pronouncing all of those words correctly and not tripping over my own tongue. In other words, Dr. Kwok, you crawl around in data. You look at data. I love what you do because you take a look at data, you mine data, and you put it into a 3D model almost, don't you? You think about, well, what do these numbers mean in terms of what kind of care people are getting or what's happening to people after they get their care? So super important topic. And as we dive in, can you tell us a little bit about yourself and how in the heck did you get into rheumatology? What's your origin story?
Yeah, I think so. I'm a rheumatologist and clinician investigator. So, as part of my job, I see patients with all types of autoimmune diseases, and in particular, inflammatory arthritis, such as gout, which is one of my clinical and research interests. I dedicate around 50% of my time seeing patients and another 50% of my time doing research. And in particular, gout and other crystalline diseases, crystalline arthropathies, are a particular interest to me. It actually is the most common inflammatory arthritis worldwide. And the public, it doesn't get the limelight it deserves in the public. And upwards, depending on what study you look at, 4 to 6% of everyone has been diagnosed with gout in the past. And most importantly, gout is one of the rare rheumatic diseases that is completely curable with medication. In spite of that, we see a lot of care gaps in how gout is treated, and not just amongst kind of individuals, but as a health systems. So
Yep.
this really led to the impetus of this study as well as my overarching research program.
Yeah, so this title of your study really suggests to me how painful gout is because it's actually driving people to an emergency room. That tells you, it's a profound, can be a very profound and painful disease. So specifically, Dr. Kwok, you looked at a group of people who showed up at an emergency room. Is that correct?
Yeah, so we looked at within the years of 2014 to 2023, all of the encounters at Ontario's emergency departments for a gout-related diagnosis or a discharge diagnosis of gout. And within Ontario, we're very blessed to have a very rich data source where all encounters with the healthcare system were recorded in administrative databases. So we were able to take a kind of a 360 approach to look at all levels of care, including kind of what happened during that care, um, before and after the presentation as it pertains to gout.
Yeah, it's when you described gout as a disease that is crystalline, so that it's crystals drive this disease. So explain for our audience, just really briefly, what does that mean? What's a crystal? Why does it create a
Mhm.
pain in my foot that is excruciating?
So, the underlying understanding of gout is that when patients have very high levels of uric acid or serum urate, that because of various triggers, whether that be dietary triggers, infections, dehydration, etc., that these crystals can precipitate or gather in joints and, the most commonly affected areas in the foot. And this causes quite severe and significant pain, swelling in the joint. And in this study, as we see, leading patients to present to the emergency department. It's often, when this first happens, patients do not know what's causing it. And with the severe pain, number one, they want to know what's going on, whether it's life-threatening, and number two, to see an emergency department about treating the pain. So, there's various causes of gouts, various risk factors, but because we understand the disease course pretty well, we also have targeted treatments that we can give the patients to both treat the flare and prevent flares from occurring again.
Right. So how many people were in your study? So now that we kind of have a better understanding of what gout is and that people are landing in emergency rooms, whether they know they have gout or not, they're there because they have a problem they're very worried about. How many people were in your study? How many records did you look at?
So within the 10-year period of 2014 to 2023, we saw approximately 125,000 emergency department visits for gout within this 10-year period. And of that, around 70% were incident cases, meaning that those cases, those patients did not have a previous gout-related encounter 5 years before coming to the emergency department. And unfortunately, we saw a large burden amongst males and older males. So the average age was approximately 60 years old, with over three-quarters of the patient population being male. And we also unfortunately saw a lot of sociodemographic determinants of health being represented in patients with gout presenting to the emergency department, more likely to live in materially marginalized areas where they have less likelihood of having access to basic material needs. And these patients also had a lot of comorbidities, meaning associated medical conditions such as high blood pressure and diabetes.
Wow. Um, I'm not surprised to hear about the socioeconomic issues at play there, and I imagine related to nutrition, diet, all of those kinds of factors on one's health. What, when you think about the people that are coming to emergency, when should I go to emergency for gout? When do I know I need to go to an emergency department? Is it simply about the pain?
So I think it's twofold, right? Number one is the uncertainty because, you know, when someone experiences their first gout flare, they don't know that it's gout, right?
Right.
It's a different story if someone has had multiple flares and they know, I've had this before, I was diagnosed with gout, I know how to deal with it. So, amongst all these numbers that we looked at, one of the main aspects of our study was we really wanted to look at what happened to the patient before and after that emergency department visit for gout, because that will help us inform whether that our healthcare system is well equipped to treat these patients. If there were any kind of preceding events or events leading up to the emergency department presentation for gout, and also afterwards, what happens to these patients when they're discharged. And unfortunately, we saw that within a month after emergency department discharge, only one-fifth of patients had gout-specific follow-up with either their primary care provider, such as their family physician, nurse practitioner, or other physicians in general. Only a quarter received medications to treat the flare, And an astonishing 10% of patients were prescribed an opioid, which is not a treatment concordant, a guideline concordant treatment for gout. And also importantly, within 3 months, about one third of patients, just little than one third, return to the emergency department, with 10% or 1 in 10 specifically for gout. So to answer your first question, in an ideal health system, at the first presentation or with a stereotypical gout flare, the patient should ideally have access to their family physician or primary care provider to be assessed for potential gout and initiate treatment. Now, we all know with the healthcare access issues plaguing not just Ontario, but across Canada, that can be an issue. So, one of the messages that we want to take home is within models of care and with kind of the theme of this year's annual scientific meeting,
Yeah.
I think, different models of care, including for gout, maybe a rapid access gout clinic might be of use to narrow these care gaps amongst patients who are suffering from gout and having to come to the emergency department.
Yeah, if I'm a person who's presented in the emergency room, let's say I'm a first timer, I first experienced it. I get discharged. What I heard you say is that an appallingly low number are then doing what they need to do, or the healthcare system hasn't given them what they need to do a month after that. So, what can we say to people like me? I don't have gout, but let's say I do. I'm discharged. There should be 4 or 5 things written on a bit of paper that says, make sure you do these things or you're going to land back in emergency. So what do I do? How do I self-advocate for myself?
Yeah, I think, it's a really complex question, right? So beyond self-advocacy, multiple previous studies have also indicated that even amongst healthcare providers, they often view gout as what we call an acute condition, where after the flare happens, that's all that needs to be done. But increasingly, we're aware that gout is really a chronic disease. And I really appreciate platforms such as this from the Arthritis Broadcast Network really shining light into gout because I personally don't think that gout has the degree of attention that other rheumatic diseases such as osteoarthritis, rheumatoid arthritis, etc. have. So, just giving us and our team a platform to talk about this study, I really appreciate that because that will kind of allow gout to fall into people's radar. I think, there's also needs to be work in terms of continued medical education amongst perhaps emergency room physicians, primary care providers, because we know that with the sheer population of patients with gout, rheumatologists alone cannot manage, right?
Right.
4 to 6% of Canadians suffer from gout. So, as I mentioned, perhaps various models of care, whether that be virtual-based clinics, rapid access gout clinics, or collaborating with our advanced practice providers in arthritis, really can revolutionize gout care and narrow some of these care gaps.
Yeah, so basically, if you're out there and you're living with gout or have had a gout flare, it's not necessarily something you just treat once in the emergency room and forget about. There are treatments that keep gout at bay. I'm imagining that's what you're
Mhm.
getting at here, and that we're not being put under that the care model for gout is certainly broken. I think it's safe to say that, or one doesn't maybe even exist.
I think there's certainly room for improvement.
Yeah,
And I really like your point in the take-home message that if you as a patient suffer a gout flare, don't forget about it.
yeah.
There's a chance it could come back. There's a chance it could be associated with other diseases, as we mentioned, high blood pressure, diabetes, other what we call cardiometabolic diseases, and really bring awareness to your care provider to really look into things and address some of the root causes that lead to this disease.
Yeah, it's so much of healthcare these days, Dr. Kwok, is actually put on the patient unless we're active, unless we're, agitating a bit to try to get access to care. we're at home and we're in pain or we're not, generally doing well. And gout is so immobilizing. And we've heard from you that based on your study, you've seen great inequity in who's falling through the cracks, in other words. And it's the same people that fall through the cracks due to socioeconomic circumstances that fall through the cracks in a lot of other areas of health, but also life in general. And I think that's a really important point to drive home here is that it's not enough for ACE to be advocating for individual patients. It's for the system, which has systemic breakdowns in it, basically.
I completely agree with those points.
Yeah. Um, when rounding off our conversation here, Dr. Kwok, we so appreciate you spending this time with us for the interview. You mentioned this year's theme, the meeting. Every year, the annual scientific meeting holds a theme. And this year's is Shifting Tides, Embracing Change in Rheumatology, and celebrate the evolving landscape of it. So, always good to celebrate, but always good to look ahead too. Patients are always wanting to know what's the next best thing, what's the next great thing coming out of science. When you think about this area that you're so expert at in gout, what do you think the next 5 or 10 years holds for gout?
I think really number one, as in within rheumatology, models of care, various models of care. Gout is one of those diseases where after the initial flare, management could potentially be through virtual means,
Right.
such as through telephone or through video-based platforms, but really solidifying those modalities as a viable treatment approach will be one of the key pathways in gout management because of the main reason there's not enough rheumatologists to see every patient with gout, and there's clear knowledge gaps amongst other providers. How do we narrow this with the finite resources that we have within the healthcare system? I also think, and this kind of a hot topic within rheumatology is how do we optimize these kind of medications that we've all heard about, like the GLP-1 agonists or SGLT2 inhibitors. So there's really a robust body of data over the last 5 years showing that these medications, and particularly the SGLT2 inhibitors that treat what we call cardiometabolic diseases and renal diseases, are also effective in gout.
Hmm.
So I think within rheumatology, comorbidity management, and as I like to say, how do we, knock off various targets with one medication to simplify medication regimens for patients will be very important. So that also involves collaborations and shifting tides as the theme with other various healthcare specialties such as nephrology, cardiology, endocrinology, because we know that gout clusters with other diseases. So I
Right.
think those two would be one of the main features. And also the third pillar is how do we manage what we increasingly see as being difficult to treat cases? So difficult to treat is a very topical theme amongst rheumatology, really rooted in inflammatory arthritis. But as a gout research community, we're also noting difficult to treat gout cases. So, alongside international collaborators, our group at Sunnybrook is looking at defining this and also down the line, hopefully suggesting treatment regimens that can effectively treat these patients with recalcitrant or resistant gout disease.
So, in other words, research that looks at what you're going to hopefully be able to detect earlier what someone who presents with gout may be more difficult to treat. You're going to try to identify that earlier. Is that
I
the
think
goal?
I think one of the issues plaguing gut management is the lack of recognition and interest within the community. So
Okay.
there's not a lot of medications available right now. There is a class of medications that's not available in Canada. So, we need platforms like this to really raise awareness from a health policy perspective, try to bring these called uricase medications to Canada to treat what we know are a distinct population of patients with very difficult to treat gout. So I'm not saying kind of most people fall into that bucket, but certainly there are folks that fall into that bucket
Yeah.
that we don't have good treatment options for.
Okay. This is, we could go on and on and on, and then we'd both miss the meeting that's going to take place. We'll have to close the conversation here, but we'd love to have you on again, Dr. Kwok, and perhaps tackle more of these sort of topic sub-themes, I think, within the gout topic overall. So I'm already putting you on notice. I'm going to be knocking on your virtual door again. But really appreciate your time and congratulate you again on your work and your poster. Gout, as you say, is so common, but the first words you said that just lodged into my brain is gout can be cured. Not necessarily we turn it off, but there's ways to manage it that are as good as a cure.
That
And
is
and I
correct. That's for
and I
sure.
think that's the big message here for folks who are struggling with gout. So we have information on our website. We'll give you some links at the end of this interview. And again, we thank you very much, Dr. Kwok, for spending time with us here at the Arthritis Broadcast Network as part of the hashtag See Arthritis event.
Thank you so much.
Thank you. Talk soon. Bye, everyone. We'll see you on the next interview.